Hi, my name is Kush Shah. I'm a third year medical student at Eastern Virginia Medical School, and I'm going to be presenting our abstract about the impact of glaucoma severity on streamlined canaloplasty outcomes. So, conventional and minimally invasive glaucoma surgery, or MIGS procedures, are often selected based on the stage and severity of glaucoma. For patients with severe glaucoma who are at a higher risk of disease progression, more invasive procedures are selected, and for patients with mild to moderate glaucoma, MIGS is preferred. This present study is part of a larger Advocates for Glaucoma education initiative and aims to evaluate the long-term outcomes of streamlined canaloplasty with implant-free dilation in patients with mild, moderate, and severe glaucoma. So a retrospective chart review was conducted in 128 patients who underwent streamlined canaloplasty alone or in combination with cataract surgery for the treatment of open-angle glaucoma over a 1-year period, all done by a single surgeon. Glaucoma severity was determined as mild, moderate, or severe based on preoperative visual field and optical coherence tomography testing. Outcomes measured included a reduction in mean intraocular pressure, or IOP, the percentage change in mean IOP, as well as a reduction in the number of IOP lowering medications from baseline through 12 months post-op in patients with mild, moderate, and severe glaucoma. For results, the mean number of medications was reduced from baseline to postoperative 12 months in all three glaucoma subgroups. However, the change was significant only in the mild subgroup. Postoperatively, the proportion of eyes requiring greater than 3 medications showed a four-fold reduction in the mild group and a two-fold reduction in the moderate group. From baseline to postoperative 12 months, the proportion of eyes on 0 medications increased by 3-fold in the mild group, 4-fold in the moderate group, and about 6-fold in the severe group. So this is an overview and a chart of all the data that we compiled over a 1-year period. I will go into more detail over the next couple of slides, but some key points here that I want to make are that for the mild group, 56% of patients were on 0 IOP lowering medications by the 12-month postoperative period. 20% of the moderate group were on 0 IOP lowering medications by the 12-month point, and 25% of the group with severe glaucoma were on 0 IOP lowering medications by the 12-month postoperative period. This first graph shows the change in mean intraocular pressure from pre-op to 12 months post-op. The blue line represents patients with mild glaucoma, the orange line represents patients with moderate glaucoma, and the gray line represents patients with severe glaucoma. And as you can see from the chart, patients of all three severities demonstrated a significant decrease in mean intraocular pressure from the preoperative standpoint to the 12 months postoperative meeting, with a mean IOP for mild glaucoma going from 17.2 to 13.5, and then going from 16 to 11.7 for the group with moderate glaucoma, and going from 17.3 to 14 for the group with severe glaucoma. This graph shows the percent change in intraocular pressure starting from day 1 post-op all the way to 12 months post-operative. We noticed a significant percent change in intraocular pressure for all three severities from pre-op to 1 day post-operative that remained statistically significant in comparison to the preoperative measurement all the way through 12 months postoperative. Once again, this was for all three groups, including the mild, moderate, and severe glaucoma patients. This last graph shows the mean number of IOP lowering medications that patients were taking preoperative to 12 months postoperative. While the number of medications remained comparable between the pre-op and 12 months post-op groups for the moderate and severe glaucoma patients, this number was significantly lower in the group of patients with mild glaucoma, going from 1.3 pre-op to 0.7 at the 12 months post-op period. So IOP reduction from baseline to all post-operative time points from month 1 to month 12 was statistically significant in all three subgroups of mild, moderate, and severe glaucoma. Patients with severe open-angle glaucoma at baseline were the least likely to be on fewer medications at 12 months. And the number of medications at 12 months was comparable in the moderate and severe subgroups. However, These were statistically significantly lower in the mild subgroup when compared to the moderate or severe subgroups. In conclusion, eyes with mild, moderate, or severe open anal glaucoma benefited from treatment with streamlined canaloplasty, showing a reduction in intraocular pressure from baseline at all post-op time points. Streamlined canaloplasty was effective in lowering intraocular pressure even in patients with severe glaucoma, although there was not much change in the number of medications for this subgroup. The results of this present study are promising and can aid in decision making for patients who are MIGS candidates. For acknowledgments, I want to thank Dr. Constance Okeke, a renowned expert in the field of glaucoma, Taylor Nikki Drake, a fourth-year medical student at Eastern Virginia Medical School, and Dr. Siddharth Bhargava, currently a glaucoma fellow at WashU. This study would not have been possible without the help of the entire team. And the reference for this project was a study by Lascano Gomez and Anzulatos in 2023 about the streamlined canaloplasty system. Thank you for listening to my presentation.